Good evening, everyone. Hope I'm audible. Let me just check that part, then we'll start. So I hope I'm audible. Let me check. Good evening, everyone. Okay, perfect. All right. So welcome to today's session of biochemistry. So in this session of biochemistry, what we are going to do, my dear students, is whatever the topics we had discussed in the previous session of our biochemistry. So I would like to continue that particular aspect. So for all the students who ask me, sir, is it sufficient? So I'm telling you very simple as that. Honestly, is these two sessions of biochemistry is sufficient for your FMGE exams quick revision of biochemistry. Okay, for what? Quick revision of biochemistry, it is sufficient. So most of the questions will be covered from these two sessions itself. I can tell you based upon the experience what I have seen throughout the time in the questions of biochemistry. तो उस हिसाब से मैं material बनाया हूँ and these will cover at least 8 to 10 questions minimum to minimum, but I can guarantee at least how much percentage. So 50% of the questions will be from our live, that much I can guarantee you. So you can utilize this particular session for your revision. Okay, so in earlier discussion we had done it till the amino acids chapter. So the next important aspect after amino acids, my dear students, that is collagen related defects. Okay, so the collagen is what? Collagen is a type of structural protein which is the most abundant protein of the human body. So it is present in your skin, it is present in your bones, it is present in your subcutaneous tissue, so many places it is present. So this collagen is what? Collagen is a protein. Yes, it is a protein which is basically what? Which is having a structural function. So the major structural protein of the body is collagen. So there are types of collagen. Here I have 4 types of collagen listed, because this collagen related, what they'll ask you is, my dear student, they'll ask you the type of disease which will appear as a result of defect of collagen. So we have type 1 collagen. Type 1 collagen mainly located where? On your ligaments, bone, dermis and tendons. Okay, so in your ligaments, bone, dermis and your tendons consist of which collagen? Type 1 collagen. Repeat everybody with me. Repeat with me. Type 1 collagen. Type 1 collagen is located where? Type 1 collagen is located in, yes, ligaments, bones, dermis and also your tendons. So when we are looking at this type of collagen, automatically if there is a protein, what can be there? There can be a defect of this protein. So if there is a defect of type 1 collagen, patient will develop a disease called as osteogenesis imperfecta. Osteogenesis imperfecta. So osteogenesis imperfecta is a type of disease caused due to mutation of which collagen? Type 1 collagen. So this osteogenesis imperfecta, the people will have clinical features such as bone defect. So basically immediately after the birth, if you notice these children, they will have a lot of deformities and also easy fracture of the bones can be seen with this disease, osteogenesis imperfecta. So there is a defect of type 1 collagen. Because of the defect of which collagen? Type 1 collagen, we are getting a disease, osteogenesis imperfecta. So due to osteogenesis imperfecta, the patient will have bone defects, development of the bone will be defective, and also along with that sclera will be bluish color. Which color? Bluish color. Blue colored sclera. If you find a blue colored sclera, you need to think of which defect? Type 1 collagen defect. Okay, let's go to the next important aspect, type 2 collagen. Type 2 collagen is less commonly asked, I can tell you. So type 2 collagen mainly located in the cartilages of your body, right? Cartilages consist of which collagen? Type 2 collagen. If there is a defect, we'll get a disease called as chondral dysplasia. Okay, so cartilage means contra. Cartilage means contra. So there is a defect of the cartilages. And type 3, my dear student, it is located where? Type 3 is located in the aorta. Type 3 is located in the aorta, and as well as it is also located in the skin of the body. In where? In the skin. So there are 2 places. The patient, if there is a defect of type 3 collagen, they will develop a disease called as Ehlers-Danlos syndrome. Which syndrome? Ehlers-Danlos syndrome. So this Ehlers-Danlos syndrome, my dear students, you might have seen people who have the ability to stretch excessively. Excessive stretching of the skin is due to which disease? Ehlers-Danlos syndrome. And they are also at a risk of, they are at a risk of developing diseases such as the aortic dissection, aortic dissection. Along with the aortic dissection, patient can also have defect of what is that aortic aneurysm. What is that aortic aneurysm? These two are possible diseases associated with type 3 collagen defect. So that is your Ehlers-Danlos syndrome. The last but not the least, that is your type 4 collagen. It is located in any basement membrane of the body. What is basement membrane? Basement membrane is the membrane on which any epithelial cells, for example, let's take one epithelial layer. So the epithelium is sitting on the membrane called as basement membrane. So it is located where? It is located all the basement membranes of the body. So the patient will have defect of this type 4 collagen leading to a disease called as Alport syndrome. बच्चों कौन सी syndrome होता है? Repeat करो. Alport syndrome. Okay, so Alport syndrome, my dear students, will have a clinical features such as anterior lenticonus. What is anterior lenticonus? So lens is a excessive curvature. Lens has a excessive curvature towards which side? Towards the anterior side, and also patient will have SNHL, sensory neuronal hearing loss. Sensory neuronal hearing loss. And glomerulonephritis. Why glomerulonephritis will occur? Because there is a defect of your glomerulus. Why defect of glomerulus? Because glomerulus consists of, glomerulus is made out of what? It is just a capillary. So the capillaries consist of what? Basement membrane. So if there is a defect, it will lead to glomerulonephritis. And if you take a biopsy, you can find appearance. It's a very, very important basket wave appearance. Basket wave appearance. And it is a X-linked disease. It is a X-linked disease. It can be both recessive and dominant, but predominantly we tend to find X-linked recessive disease as a X-linked recessive disease. Which one? Alport syndrome. Which syndrome? Alport syndrome. Okay. So that completes our what is that protein related discussion. So in the proteins part, that is a main important protein, that is your collagen. Once we are done with the collagen, okay, so once we are done with the collagen, let's get into the next one, lipids, my dear student. In the lipids chapter, so there are some important fact based these things, because I'm telling you there is the enzymes which are responsible for digestion of some particular lipids. So based upon the deficiency of the enzyme, you tend to get asked about the questions. That is your lipid chapter. So lipids is made out of what? Lipid is made out of two things. One is your fatty acid, and one more is your alcohol. What is that? Alcohol. So now we need to know, sir, what is a fatty acid? Okay, so the word itself is clear, fatty acid. So it consists of an acidic group. Acidic group in the organic chemistry is which one? Yes, COOH. COOH makes it as a acidic group. COOH makes it as a acidic group. So this acidic group is attached with a long chain of carbon atoms. Long chain of carbon atoms. So basically 20 carbons, 30 carbons, long chain is there. Along with that long chain, there is a functional group, my dear bacho. What is that functional group? COOH. If COOH along with the long chain of carbon, we'll call it as a fatty acid. Okay. Then lipid is a composition of what? Fatty acid and alcohol. So there are two functional groups in a lipid. One is OH group. Yes, of course, that is your alcohol. And one more is your acidic group, that is your COOH. So COOH and OH are the functional groups of your what is that? Lipids. So we have two types of lipid, simple lipid and complex lipid. It is determined based on the structure of the lipid. Based on what? Structure of the lipid. The simple lipid. Simple lipid is a simple definition. Fatty acid should be there, OH group should be there. So sir, what is the OH group? Which is the alcohol present in the body? Which is the commonly present alcohol in the body? Now somebody tells me Glenfiddich or some other brand's name. No, the alcohol present in the body is which one? Glycerol. What is that? Glycerol. Okay. So glycerol is what? Glycerol is a alcohol. So fatty acid along with alcohol, if there is some other group, if it is present, extra other group if it is present, other group if it is there, yes, then I'll call it as what? Yes, I will call it as a complex lipid. So what can be other group? So if carbohydrates are present, if carbs are present, then I'll call it as a glycolipid. So glycolipid is a composition of fatty acid, alcohol, and one more thing will be there, carbohydrate. Then I'll call it as a glycolipid. If phosphate group is present, dear बच्चों, उसी को क्या बोलते हो? We will call it as a phospholipid. So phospholipids are present where? On your cell membrane. All of you might recall. So on the cell membranes we will have which one? Phospholipids. And if proteins, if they are present, then I'll call it as a lipoprotein. So there are three things you need to remember. Carbohydrate if it is present, glycolipid. If phosphate group is present, phospholipid. If protein is present along with the lipid, then I'll call it as a lipoprotein. So basically structure of a lipid, I have mentioned it here. R represent what? Long chain of carbons, and COOH is the functional group. So this is your what? Lipid will be there. sorry, this is your what? Fatty acid will be there. This is your fatty acid. Along with the fatty acid, one OH group, that is glycerol, if it is added, that is the structure of the lipid. Sir, do they ask commonly about the structure of the lipid? Usually they don't ask the structure of the lipid, but if at all sometimes if our time is bad, they can just write the structure on your what? On a paper and ask you what is it. Okay, so when you look at that, you need to think about this much. Long chain is there, is there. COH is there, is there. OH group is there, is there. If three things are there, then I'll call it as a lipid. So let's start off with the first type of lipid. What is that? Glycolipid. बच्चों कौन सी lipid है? Glycolipid. When we are speaking of glycolipid composed of what is that? Three things. Yes, fatty acid, alcohol, and a carbohydrate. So if carbohydrate, if it is present, then we will call it as glycolipid. So in the glycolipid, which type of carbohydrate is that? That also matters, because carbohydrate, is it one structure or we have multiple types of carbohydrate? We have types of carbohydrate, right? So we have monosaccharide, we have disaccharide, we have oligosaccharide, we have polysaccharide. So based upon which carbohydrate is there, we have further classification. So we have first one, that is your cerebrosides. What is that? Cerebrosides. So cerebrosides are a simple things. They consist of which one? Monosaccharide. They consist of what? Monosaccharide. Monosaccharide plus fatty acid plus alcohol. If three are there, then I'll call it as a cerebroside. Cerebroside consists of which one? Monosaccharide. So what are the examples of monosaccharide? Yes, if glucose is present, then I'll call it as a glucocerebroside. If galactose is present, I'll call it as a galactocerebrosides. Okay, so what is the function? They are mainly responsible for the nerve function, my dear student. Glycolipids are responsible for the nerve function. Okay, so these glucocerebrosides are metabolized by an enzyme called as glucocerebrosidase. Okay, what is the name of the enzyme? Glucocerebrosidase, responsible for the digestion of what? Glucocerebrosides. So some people tend to get confused with this one. I'll explain it very clearly. Listen to me. Your body requires glucocerebroside. Okay, so body produces the glucocerebroside. The glucocerebroside does its membrane function. After the membrane function is done, that has to be digested. Means synthesize, do the function, get digested. That's how body works. So for the digestion of glucocerebrosides, we require an enzyme. Remember, beta glucocerebrosidase. Beta glucocerebrosidase. If there is a deficiency of this enzyme, leads to a disease. Repeat everybody with me. Gaucher disease. What is that? Gaucher disease. So Gaucher disease occurs as a result of deficiency of which enzyme? Beta glucocerebrosidase enzyme. Which enzyme? Beta glucocerebrosidase. Which enzyme? Beta glucocerebrosidase deficiency leads to Gaucher disease. So automatically here what will be there? Glucocerebrosides are produced, but they are not metabolized. So body will have excessive accumulation of glucocerebroside, leading to a CNS defect symptoms. Okay, then galactocerebrosides. Galactocerebrosides is metabolized by an enzyme called as galactocerebrosidase. Glucocerebrosides are metabolized by glucocerebrosidase. Automatically, galactocerebrosides are metabolized by galactocerebrosidase. This galactocerebrosidase enzyme has two types, my dear student: alpha subtype and beta subtype. Means it has had two types of isoenzyme: alpha subtype and beta subtype. If there is an alpha deficiency, leads to a disorder called as a Fabry's disease. Leads to a disorder called as Fabry's disease, and beta deficiency leads to Krabbe's disease. What is that? Krabbe's disease. Okay, so beta, Krabbe, alpha, Fabry's. Okay, then let's talk about the gangliosides. So gangliosides are represented by alphabet which one? GM. Alphabets which one? GM. So ganglio, what is that? Ganglioside. Sir, what is a ganglioside? So cerebrosides are monosaccharide, but instead of monosaccharide, if oligosaccharide is present in a glycolipid, I will call it as what? Well, I'll call it as a gangliosides. So my dear student, these gangliosides are divided into types: GM1, GM2, GM3. So basically, GM is a word used for representing ganglioside. So gangliosides have GM1, GM2, GM3. Okay, among which GM3, my dear student, they are the simplest. They are the simplest one. They are the simplest one. GM1 ganglioside. What is the role of the GM1 ganglioside? So all the gangliosides, as I'm telling once again, listen to me. Gangliosides in the experimental level, they're very much applied on the treatment of curing of cancer. Okay, a lot of research is going on. Okay, but I'm telling you, in the body as such, they have their function, that is membrane function. So for the better functioning of the cell membrane, we require ganglioside. So these GM1 gangliosides, my dear students, work as a receptor. Receptor for what? receptor for your very important, yes, that is your cholera toxin. Which toxin? Cholera toxin. Which toxin? Cholera toxin. So cholera toxin comes in, once cholera bacteria comes into the body, it will produce a toxin. That toxin go and bind with the GM1 ganglioside, then it will go and interact with the cell. That is which pathway? Adenyl cyclase pathway, leading to what? Leading to diarrhea. Okay, then my dear students, this GM2 ganglioside, okay, so these GM2 gangliosides are metabolized by hexosaminidase enzyme. What is the name of the enzyme? Hexosaminidase enzyme. So hexosaminidase again has two subtypes, alpha subtype and beta subtype. Alpha subtype and beta. So hexosaminidase alpha deficiency leads to Tay-Sachs disease. Beta hexosaminidase deficiency leads to what is that? That leads to your Sandhoff's disease. So in both of these diseases, again, what we tend to find? We tend to find deposition of ganglioside. Deposition of which substance? Ganglioside. If at all there is a deposition of cerebroside, then it should be either beta glucocerebrosidase deficiency or galactocerebrosidase alpha or beta deficiency. So if there is a, in the biopsy you find excessive amount of what? Excessive amount of deposition of cerebrosides in the body, and also found to have deficiency of, for example, beta galactocerebrosidase. What is the disease? The disease is, yes, caused by Krabbe's disease. Okay, then the same way, if gangliosides are there, ganglioside deposition will occur as a result of what? As a result of, yes, your deficiency of hexosaminidase. All right, let's go to the next one, that is your phospholipids. Phospholipids. So phospholipids are present in your cell membrane. All of you know that? Yes. Yes. Okay. Now that they're present in the cell membrane, so there are types, my dear students. What are the types we have? We have glycerophospholipids. What is that? Glycerophospholipids, and and we have one more subtype called as sphingolipids. What is the name of the lipids called as? Sphingolipids. What are the two types of lipids we have? So sphingolipids, and we also have glycerophospholipids. Sphingolipids and glycerophospholipids. So these glycerophospholipids and sphingomyelin. So sphingolipids are metabolized by an enzyme called as sphingomyelinase. Okay, what is that? Sphingomyelinase is the enzyme responsible for the digestion of sphingolipids. So deficiency of sphingomyelinase leads to a disorder called as Niemann-Pick's disease. Which disease? Niemann-Pick's disease. Niemann-Pick's disease. In the same disease, you can see which cell? Foam cells. Which cell? Foam cells. Foam cells are also seen in which disease? Let's see if you can recall. Yes, tell me. Come on, any guesses? Foam cells are also seen in not only in your Niemann-Pick's disease but also found in which disease? Yes, they're found in a disease called as atherosclerosis. Which disease? Atherosclerosis. Which disease? Atherosclerosis. Okay. All right. Let's continue. So phospholipids present in the cell membrane. Which type of one? Which phospholipid predominantly called as phosphatidylserine? Where is located? What is located? Phosphatidylserine is located on the inner side of the cell membrane. What do I mean by this? If I consider this as one cell, okay, cell membrane. So cell membrane has two sides, outer side and inner side. So your yes, phosphatidylserine will be located on the inner side of the cell membrane. Okay, it only comes out, what is that? Phosphatidylserine comes out only during apoptosis. Okay, that is why we use a stain, annexin stain. Why annexin stain is used? This can be a very powerful question, can be asked integrating of pathology with your biochemistry. Why annexin stain used for the apoptosis? Because annexin binds with your phosphatidylserine. Which one? Phosphatidylserine. That is why we use it as a dye for the apoptosis diagnosis. Let's continue the discussion. Then we have lipoproteins. Lipoproteins, my dear student, it is made out of what is that? Fatty acid, alcohol, and protein. Okay, fatty acid, alcohol, and if phosphate group is there, phospholipid. If carbohydrate is there, glycolipid. If at all protein is present, then we will call it as a lipoprotein. Okay, so this lipoprotein consists of what? Proteins. Okay, now apoprotein. So apoprotein is the, what is in this apoprotein? Apoprotein is the protein part of lipoprotein. What is apoprotein? Apoprotein is the protein part of lipoprotein. What is the name of that? apoprotein. What are the types of apoproteins we have? Apoproteins such as B48, B100, C, E. Okay, there are types. Types of apoproteins are which ones? B48, B100, C, E are the apoproteins. So there are types of lipoprotein. One of them are your chylomicrons. Where are they formed? Chylomicrons are formed in the intestine. They carry the lipids. They carry the lipids from the intestine to liver. Where do they carry? From the intestine to liver. So carrying of your, what is that? Carrying of lipids is done by your chylomicron. Chylomicrons are synthesized where? So as you eat the food, if the food consists of fat, that fat will be transported to liver in the form of chylomicrons. In the form of chylomicrons. And we have one other two other subtypes. VLDL, very low density lipoprotein, intermediate density lipoprotein, and low density lipoprotein, and a high density lipoprotein. So among which is the good one, which is the bad one, how they are bad, let's try to understand and make a note out of it. So this VLDL, IDL and LDL, VLDL, IDL and LDL, all of them carry the cholesterol or lipid, carry the lipids from where to where? From lipids from the liver to, yes, from the liver to the tissues. Okay, so that is carrying is done by which ones? That is your VLDL, IDL and LDL. The high density lipoprotein is a different thing. What is this high density lipoprotein? High density lipoprotein causes reverse cholesterol transport. Reverse cholesterol transport. Okay, reverse cholesterol transport is done by which one? Yes, that is done by your, yes, that is your high density lipoprotein, basically from the tissues. Like what happens, I'll give an idea, listen to me. You eat the food consists of lipid. All the lipids will be taken into the intestine, like whatever you have taken from the food. So that from the food, the lipids are extracted and they are sent to where? Liver, in the form of what? Chylomicron. So chylomicron is having what? The relation from where? From the intestine to the liver. So from the liver, now liver has to distribute the cholesterol all over the body. Where it has to distribute? Basically, it has to send cholesterol wherever it is required. For example, to synthesize the sex steroids. To synthesize the sex steroids, gonads require the cholesterol. That cholesterol transport is done by your who? Yes, VLDL, IDL and LDL. So they carry the cholesterol from the liver and they take it and give it wherever it is needed. Okay. Now, for example, let's imagine. So in the adrenal gland, it was utilizing for the steroid synthesis. Adrenal gland or adrenal cortex is utilizing your cholesterol. So cholesterol has gone to the adrenal gland. There is sufficient amount of steroidal hormones. Now extra cholesterol will be there. Extra cholesterol will be in the adrenal gland. So, and from the adrenal gland, that cholesterol has to be carried to what? To the liver for the metabolism. So that reverse cholesterol transport mainly is done by your which one? High density lipoprotein. So, sir, you have been telling lipoprotein, you told apoprotein. What is the function? How do they work in the body? Right? So lipid is there, right? Lipid has bound with the apoprotein. Now it become a lipoprotein. Now this apoprotein, what does it do? Okay, so it is responsible for the interaction with the receptors. Interaction with the receptor. So in the cell, we will have some subtype of receptor called as PPAR receptor. Which one? PPAR receptor. PPAR receptor is the type of nuclear receptor. We have subtypes also in that. PPAR alpha, PPAR gamma is there. Remember, they interact with PPAR alpha, which one? PPAR alpha is interaction is done by your, what is that? That is your apoprotein. Once it is activates the PPAR alpha. PPAR alpha is located where? It is usually a type of nuclear receptor. It is type of which receptor? Nuclear receptor. It is located on the nucleus of the cell. So upon the activation, what will happen? Cholesterol breakdown will occur faster. So the activation of enzyme. Which enzymes it will activate? Apoprotein C. Which enzyme? Sorry, which enzyme? LPL. What is LPL? Lipoprotein lipase. What is that called as? Lipoprotein lipase. Lipoprotein lipase is what? Lipoprotein lipase is activated by apoprotein C. Okay, and also it will activate one enzyme called as lecithin cholesterol acyl transferase. By which apoprotein? Apoprotein A. Notice it, apoprotein A. Apoprotein A activates which one? Which enzyme? LCAT enzyme. Which enzyme? LCAT enzyme. That activation is caused due to what is that? Apoprotein A. Okay. Then let's talk about the synthesis of the cholesterol. So when we are speaking of synthesis of cholesterol, cholesterol synthesis occurs in one location, that is your liver. Where it will occur? Liver. And I want you to remember, before going to the cholesterol synthesis, their PPAR alpha is there. No? There are some drugs, PPAR alpha agonist. They are used in the treatment of dyslipidemia, atherosclerosis, etc., etc. Which are those drugs? PPAR agonists. Come on, anybody tell me? Huh? I'm just opening the chat box. So remember, this PPAR alpha agonist are your fibrates. Are your which drug? Fibrates. Okay, which are the fibrates we have? Fibrates such as clofibrate, right? Clofibrate, gemfibrozil. Okay, so there what is that? PPR alpha agonist. Okay, anyways, let's continue. Cholesterol synthesis. For example, it's if you decided not to eat cholesterol from the food, but body requires cholesterol. Body continuously requires cholesterol for what? For the synthesis of hormones. Which hormones? Such as your sex hormones, right? Such as your steroidal hormones from the adrenal cortex, right? So they require, what is that? They require an enzyme. They require they require synthesis of cholesterol. So for the synthesis of cholesterol, your body utilizes acetyl coenzyme A. Uses acetyl coenzyme A. Okay, so this acetyl coenzyme A is a product of what? It is a product of glycolysis. It is a product of glycolysis. Remember, okay, so two molecules of acetyl CoA combines and it forms something called as a HMG CoA. Okay, from there it will convert into mevalonate. Mevalonate will get converted into, yes, that will be your cholesterol. So for that we require an enzyme, sir, that is only called as HMG CoA reductase. HMG CoA reductase. So HMG CoA reductase, it is more active when? कब active होता है ज़्यादा? When it is highly active, it is more active during the night. It is more active in where? During the night time. During the night time. So that is why we tend to tell, do not eat the food after 6 p.m. or 7 p.m. we advise, right? For many patients. So why we advise? Because in the night time, which enzyme is active? HMG CoA reductase is more active. So you eat more amount of sugar. That sugar will get converted into acetyl CoA. Now this acetyl CoA can enter into which pathway? Cholesterol synthesis. Why? Because the enzyme becomes active in the night, right? So that is why we are supposed to avoid the food intake after late hours in the evening. Okay, now when we are speaking of this HMG CoA reductase, the HMG CoA reductase inhibitors, they're inhibitors, so they are your statins. Statins inhibit which enzyme? HMG CoA reductase. Which enzyme? HMG CoA reductase. Okay, now let's continue to the next one, that is oxidation of fatty acids. So oxidation of fatty acid, what does it mean, oxidation? Remember, fatty acids, my dear students, fatty acids is a long chain of what? Long chain of carbon with what is that? COOH, right? So now these fatty acids undergo oxidation. Oxidation means what? So oxidation means breakdown of the fats. Okay, breakdown of the, yes, breakdown of the fatty acids, we call it as an oxidation. So why body has to do the oxidation? Because whenever we are speaking of long chain of carbon, long chain of carbon with COOH group, now whenever I require energy, I need to break down this fatty acid into acetyl CoA. Into what? Acetyl CoA. Why acetyl CoA? Because so we have long chain of fatty acid. Now this long chain of fatty acid will break down into small components called as acetyl coenzyme A. When they break down into small compounds called as acetyl coenzyme A, that acetyl CoA can enter into Krebs cycle. That Krebs cycle can help you do what? Yes, it can help you do, yes, it will help you for the energy production, because acetyl coenzyme A enters into the Krebs cycle. Acetyl CoA enters into which cycle? Krebs cycle. So once it enters into the Krebs cycle, this Krebs cycle, my dear students, will lead to energy formation in the form of NADH and FADH. Okay, so among these there are three types of oxidation. So there is beta oxidation, there is alpha, and there is omega, right? So there are how many types of oxidation? Alpha type, beta type, and omega. The among which most commonly in the human body, most common oxidation in a healthy individual is your beta oxidation. Which oxidation? Beta oxidation is the predominant type. So this beta oxidation includes the stages activation. Okay, so consider this is one cell. Okay, in the cell we have mitochondria. So first what will happen? Fatty acid is present where? In the cytoplasm. Now cytoplasm fatty acid gets undergoes activation. So active fatty acid is formed. Now this active fatty acid, whatever is formed, it is transported into the mitochondria. So the next one is transport of fatty acid. Which fatty acid? Activated or non-activated? Activated fatty acid from the cytoplasm into the mitochondria. From the cytoplasm into the mitochondria. Once it goes into the mitochondria, inside the mitochondria, the breakdown of the fatty acid will occur. We will call it as a beta oxidation proper. We will call it as a beta oxidation proper. So for the transport, yes, for the transport of your fatty acids, we body uses a shuttle called as carnitine shuttle. Okay, by which shuttle? Carnitine shuttle. Okay, so when I'm speaking of carnitine shuttle is a transporter. So that is why you might have noticed when you go to gym for the fat burning, the gym trainer will tell you, yes, please take this carnitine tablet. That carnitine doing what? Doing the transport of the fatty acid from the cytoplasm to mitochondria. Okay, the last process, that is the main process, that is your beta oxidation proper. That beta oxidation proper takes place in which part of the cell? It takes place in the mitochondria. Beta oxidation proper occurs where? Mitochondria. Okay, so regarding the PDF, my dear students, so what I'll do is that after the class is done, I will share this PDF to our team. Our team will upload it onto the Google Drive, and they will put that Google Drive link in the same video's description. Okay, so later in the same video description, later if you want to find, you'll find a Google Drive link. You can download from there. Okay, all right. Okay, let's go to the next part. What is the next part I want to discuss? That will be your beta oxidation proper is done. Then let's talk about the alpha oxidation. Alpha oxidation is a minor this thing, but alpha oxidation defect leads to a disease. What is the name of the disease? So leads to a disease called as Refsum disease. What is that? Refsum disease. Okay, so Refsum disease is caused by defect of which one? Alpha oxidation. Refsum disease is due to defect of alpha oxidation. Defect leads to a Refsum disease. Refsum disease, what happens in the Refsum disease? What happens is that there is an excessive accumulation of something called as phytic acid. What is that called as? Phytic acid. Now, what is this phytic acid? Now, please understand, phytic acid comes from the this phytic acid first undergoes alpha oxidation. Okay, so after alpha oxidation, now phytic acid will undergo into something called as phytinic acid. What is that? Conversion into phytinic acid. So phytic acid got converted into phytinic acid due to what is that? Alpha oxidation. Now this phytinic acid will enter into beta oxidation. Enters into which oxidation? Beta oxidation. So beta oxidation will enter phytinic acid. So if there is a defect of alpha oxidation, phytic acid will not undergo alpha oxidation. So if there is a defect of alpha oxidation due to which disease? Refsum disease, phytic acid will start to get deposited in the body. Excessive accumulation of phytic acid leads to a disease called as Refsum disease. What is the name of the disease? Refsum disease. Okay. Now this vitamins part, I have already discussed these vitamins in the chapter of in the first part of our life. In the first part of our life, we have already discussed. So let's talk about the next important aspect, that is your enzymes. Okay, so when I'm speaking of enzymes, my dear students, enzymes are most important thing. Enzyme inhibition related questions will ask, they'll ask, okay, what happens to Km, what happens to Vmax. Okay, they'll ask the questions related to this. So let's understand what is Vmax, what is Km. Okay, all of it in one discussion. Okay, now simple as that, my dear students. In the what are the enzymes? All the enzymes are proteins. They are doing what? They are working as a biological catalyst. They are working as a biological catalyst. Okay, so in the every enzyme consists of some sites. So site means what? Site means a place where some substance can go and bind. If I consider this is the structure of an enzyme, let's imagine this is the structure of one enzyme. Okay, so for our understanding, I'm drawing this. Let's imagine this as a structure of one enzyme. Okay, now this enzyme was converting from substance A used to come and bind here. Now the substance A gets converted into substance B. Okay, so the active conversion wherever it is taking place, we call it as an active site, or also called as catalytic site. Called as what is that? Active site are also called as catalytic site. Okay, so what is catalytic or active site? The basically the site where active conversion and whatever the process is taking place, where it occurs, we will call it as active site. I can have one more place. In the other place where it can, if some substance can bind, we will call it as a allosteric site. So what is allosteric site? So it is a, what is that? Allosteric site. So what is allosteric site? Allosteric site is nothing but the place where substance go on binds in the enzyme, but apart from the catalytic site. So where active conversion takes place, we will call it as catalytic site, where simply substance can go on bind and alter the structure of the enzyme. We will call it as a allosteric site. Okay. Now, when we are speaking of enzyme inhibition can be divided into two types. What are the two types? Enzyme inhibition can be divided into, yes, type 1 is called as irreversible. Okay, so when we are speaking of irreversible inhibition, so basically a inhibitor means a chemical substance can go and bind with the enzyme, and once it binds with the enzyme, there is a permanent destruction of that enzyme. Okay, means in the body that particular enzyme has been permanently destroyed. If your body requires the activity of that enzyme, your body has to synthesize a new enzyme. Only then the activity can be formed. So basically, if at all irreversible substance binds, tata, bye bye, khatam, that's it. Okay, means enzyme activity is over. When we are speaking of reversible is a different thing. Reversible, what happens? Reversible, my dear students, where there is a where there is, what is that? So inhibitor will come, it will work for few hours, the activity is gone, enzyme can get reactivated. Enzyme can get what? Reactivated. So reactivation is seen in reversible. So in the reversible, we have two types. One is competitive site and one more is non-competitive type. One is competitive inhibition, one more is what? Non-competitive. So when we are speaking of competitive versus non-competitive, let's look at this particular aspect. What exactly is that? In the competitive inhibition, so there is some substance which also wants to bind to the active site, and inhibitor also trying to bind to the same site. Inhibitor also trying to bind to the same site, means there is an enzyme, there are two substances, both of them trying to bind to the same site. We will call it as the competitive inhibition. Where while we are speaking of non-competitive, the inhibitor binds to other site, so it won't bind to the catalytic site, so it does not have a competition, it goes and binds to your allosteric site. Okay, so if at all whenever there is a inhibitor is present, how it will alter the reaction? So what do I mean by this? Let's imagine some substance A was getting converted into substance B by an enzyme E. So A is getting converted into B with the help of an enzyme E. Okay, A is getting converted into B. So during this conversion, if it is taking place, during this conversion, if at all I plot the conversion rate, means what? I will take a graph. On the graph, I will put on how fastly it is getting converted. Okay, so now there is no inhibitor, nothing is there. I'm just trying to tell you what is that. Some substance is getting converted into substance B, A is getting converted into B. So we are plotting that reaction. So basically we will use two important aspects. In the one axis, we take what is that? Concentration of the substrate. What is that? In one axis, concentration of the substrate. And the another axis, we measure the velocity. We measure what is that? Velocity of the reaction. Okay. So as the conversion takes place, I start to plot. So during at the initial time, slowly the reaction rises. It reaches to a maximum point. I will call it as Vmax. I will call it as what? Vmax. So the maximum velocity a reaction can achieve, I'll call it as a Vmax. Okay. So slowly it rises, reaches the maximum velocity, and in that velocity reaction is taken. Now, so I found the maximum velocity at this point. So if I take this maximum velocity, take the half of the velocity, so half of the Vmax, and find out the concentration of the substrate at the time. So at 50% of the maximum velocity, whatever the amount of concentration of substrate is there, I will call it as Km. Km is also called as Michaelis-Menten constant. Michaelis-Menten constant. So Michaelis-Menten constant denotes what is that? Km. That is denoted by Michaelis-Menten constant is denoted by Km. Okay. So Km is what? Concentration of the substrate at 50% velocity. Now, if I introduce what is that? If I introduce a inhibitor if I introduce an inhibitor, now inhibitor is there, it is also want to bind to the enzyme, and also what is there, the substrate also wants to bind to the enzyme. So when there is a change, that competitive, if there is a competitive inhibition, so they are trying to bind to the same site. What is the same site? Active site. So during the competitive inhibition, so what can be there? You find increase of Km, but velocity max remains the same. What do I mean by this? Very simple, sir. So inhibitor also trying to bind. Now in the presence of inhibitor, inhibitor also wants to bind. Okay, substrate also trying to bind. Okay, slowly the reaction rises. But I increase the amount of, what is that, substrate. So if I increase the amount of substrate, it will go and reach the maximum velocity. Means during the competitive inhibition, both are trying to bind to the same side. Because of that, reaction becomes slowed down. But as I raise the concentration of the substrate, I will achieve the original Vmax. So if I take that Vmax, automatically I plot and see for what is that, at half of the velocity, whatever Km, whatever the concentration is there, I will call it as Km. Okay. So as reaction got slowed down, what happened to Km? In the presence of competitive inhibition, Km is increased, but Vmax achieves the same. Vmax achieves the same. Okay. But in non-competitive inhibition, binding occurs at allosteric site. Okay, binding occurs at allosteric site. So because of the binding at allosteric site, the Km remains same, but Vmax will be decrease the maximum velocity. Means you cannot achieve the original rate of reaction how much ever you change the amount of substrate. Okay, so that is only non-competitive inhibition. Non-competitive inhibition. Okay, and in the body there are some enzymes which are majorly used for the diagnostic purposes. So we have one enzyme, that is what is that, AST is used for liver diseases diagnosis and as well as myocardial infarction. In myocardial infarction, this is not the main enzyme used, but this can be used in myocardial infarction. We can use other ones, CPKMB, okay, creatine phosphokinase MB type. Okay, we can also use troponin levels. Okay, and myoglobin will be elevated, but is it used as a diagnostic? No, but can it be elevated? Yes, it will be elevated in the myocardial infarction. Okay, then AST is used for viral hepatitis. Amylase used for acute pancreatitis diagnosis, but earlier we used to use acute pancreatitis, which enzyme? Amylase. Right now, investigation of choice for acute pancreatitis, which enzyme you are going to measure is not the amylase, but rather the enzyme used is that is your pancreatic lipase. Okay, so these are the enzymes which are there for the investigative purposes. Okay, so let's look at few of the question. The enzyme is found to be deficient in one Gerex disease. Okay, which enzyme deficient? Yes, it is a glycogen storage disorder. It is which one? Type 1 glycogen storage disorder. So type 1 type 1 glycogen storage disease is due to deficiency of which enzyme? That is glucose 6 phosphatase. Okay. So which of the following is a complex 4 inhibitor of electron transport chain? So in the electron transport chain, we have the, let's look at the options. Cyanide is there, amibarbital, TTFA, 2,4 dinitrophenol. So the answer is what? Yes, the answer is your complex 4 blocker is cyanide. Okay, 2, 4 DNP, dinitrophenol, my dear students. So that is your very important. Remember, 2, 4 dinitrophenol is what? Is a uncoupler. Is a uncoupler. It uncouples which reaction? It uncouples your oxidative phosphorylation. Oxidative phosphorylation. Which of the following is not a micro element? So micro versus macro based on the daily requirement. In the daily requirement, large amount, if it is required, we'll call it as a macro element. So the which is not a micro element, calcium is not a micro element. We require the amount of calcium is in the grams. That's why. Okay. So, which of the following pathways takes place only in the cell cytoplasm? Okay, let's look and understand. So, let's look at the options. So, urea cycle. Let's start from urea cycle. Urea cycle occurs where? Yes, urea cycle occurs in 2 places. Yes, that is your cytoplasm and mitochondria in the liver. Tricyclic acid cycle. Okay, tricarboxylic acid cycle. What is the tricarboxylic acid cycle? Krebs cycle. Krebs cycle occurs only in the mitochondria. Beta oxidation. Beta oxidation, my dear students. Beta oxidation proper occurs in the mitochondria. In the mitochondria. Okay, then we have glycolysis. So glycolysis is conversion of glucose to pyruvate. The glucose to pyruvate conversion, yes, that is your glycolysis. Very good, very good, correct answer. Okay, then let's talk about ANP acts through. ANP acts through. ANP usually acts through your, that is your CGMP, usually acts through your CGMP as a secondary messenger. Okay, so these are the important aspect which we had not covered in which slide? The first slide. In the first slide I have covered your, what is that, vitamins. I have covered your carbohydrate, and also I have covered your, yes, that is your amino acids. Now in this slide we have covered mainly which parts? Lipids, enzymes, and also your some part of protein. Okay, so with this much being said, I will share two PDFs. Both the live sessions PDFs will be available. Yes, both of them, both of them. It's other name, that's it, other name. Okay, so we have covered complete biochemistry live. So good luck. See you people in the next live. All right. So thank you so much. I think my next class will be tomorrow. So see you with the new subject. Okay. I hope आपका तैयारी अच्छा चल रहा है. I hope your preparation is going well. So if at all you have any difficulties, any doubts related to any of the subjects, you can anytime contact us. Okay. If you need, I can give my contact number. You can drop me message on Telegram or WhatsApp if you have any doubts. Okay, now we are at a crucial point of your preparation, dear students. तो अभी डरना नहीं है. Do not be scared. Stay calm, stay focused. डर तो होगा ही. Without being scared, nobody can like finish an exam easily. So being scared is totally fine, but don't let that being scared part to take over you. Okay, it's totally fine. It's quite normal. Our human brain आपको लगेगा कि I'm forgetting this subject while studying the other subject. वो सब normal है. Okay, always just keep yourself composed. डरो मत और गधों से दूर रहना. Stay away from donkeys. What do I mean by this? Mean to say is there are some people who make you scared. They are also scared and they make you scared by putting अरे time नहीं है, time होने खत्म होने को आ रहा है. भाई तुम्हारा डर अपना अपना ही. Okay, okay, you keep it, you keep that kind of people away, and that mentality also. या होगा कि नहीं होगा, पक्का होगा, क्यों नहीं होगा. Okay, definitely you'll be able to ace the exam, but only thing I'm again and again telling you, do not get scared. Don't take new materials. Okay, don't change the materials. Whatever the source of preparation, don't change them. Okay, right now what we are supposed to do, you are supposed to do is revise the thing what you have done so far again and again. Repeat करते जाना है, repeat करते जाना है, repeat करते जाना है. Okay, so as you go repeatedly, repeated preparation, that make the concepts better, and make sure to solve all the previous year question. So previous year question कहाँ से solve करें, कहीं से भी solve कर लो. YouTube में बहुत सारे पड़े हुए हैं. So faculties like us who have explained many of the previous year question, you can go through those. Okay, make sure to revise those topics जो आपको बहुत confusion होता है. Make sure to revise those topics which used to confuse you a lot throughout this preparation. Means in one complete subject, let's take biochemistry for example. During the preparation you felt difficulty with enzyme, for example. Okay, now during the preparation, now what you have to do, go to the enzymes once again extra compared to the other topics. That's how you can make sure that you didn't leave out the difficult or confusing topics. All right, so see you people. Thank you, bye bye. अच्छे से लगे रहो, आराम से पास हो जाओगे डेफिनेटली. Study well guys, bye bye.